ADHD is one of the fastest growing diagnoses in recent years. Around 2.5 million people across the UK have the neurodevelopmental condition.
I've always kind of felt a bit different to everybody and felt like something, not so much wasn't right, but just wasn't clicking.
I can have the fridge door open, the oven door open, and then remember, oh, I need to go upstairs and get something, and it's like chaos.
It's only been 16 years since ADHD was officially recognised in adults, but more recently the condition has become a huge talking point on social media.
Here's 5 signs you might have undiagnosed ADHD.
They will have a huge amount of internal chatter, a million thoughts happening simultaneously.
10 key signs of ADHD to look for in
Here's
girls.
the step-by-step guide of how to get an ADHD diagnosis.
There are 5 benefits of having ADHD.
There's a long queue people have to join to be officially diagnosed with ADHD on the NHS, and the waiting game for answers can be stressful and complicated.
There's been a lack of political will, and I think that's immensely frustrating, not just for people with ADHD, but for professionals who want to provide that good quality care.
Natalie is a single mum of twins and a carer to her elderly father. She says for most of her life it's felt like she has 100 tabs open in her brain at one time.
I can ignore really obvious things like something lying on the floor, and you think we need to pick that up, and it's like I physically can't pick it up. I would say my symptoms probably stayed at a level for a long time, and then perimenopause hit, and then they came kind of screaming out.
Attention deficit hyperactivity disorder, also known as ADHD, does not look the same for every person. But there are 3 main types: hyperactive and impulsive, inattentive and combined. You can't develop ADHD as an adult because it's a developmental disorder, meaning that it presents during childhood, but symptoms may not become obvious until later in life.
Relationships, I wouldn't say I was difficult, I would say I'm probably quite annoying. People have to create a lot of patience around me, and again, knowing that people feel that way can also have a bit of an impact on your confidence.
That must have been really exhausting for you, both physically and mentally, trying to mask these symptoms that are going on inside of you and also not knowing what they were.
Yeah, I mean, I was confused. I used to be like, what's wrong with me? Like, I felt different.
Natalie had no idea she might have been experiencing ADHD symptoms until a mum at school drop-off suggested she may have it.
I assumed she was talking about my little boy, but she stopped me and she said, actually, it's yourself. Like, I noticed all your symptoms. So I spoke to a couple of people and that I know, like family, friends and family, and I said, do you think I've got ADHD? And they were like, do you want the honest answer? And I was like, yeah, like 100%. They're like, we thought you already knew that you had it.
Natalie saw her GP and was then referred for an ADHD assessment. She was told she'd likely wait 90 weeks to see a specialist. One of the things people are asked about on the referral form is if they feel like they have lower levels of dopamine, a common trait of the condition.
I have a lot of clothes because I do buy a lot of things, which is part of that. It's like a dopamine hit, getting parcels arriving every day. Can sometimes just be random things or clothes. So managing things like money as well can be, quite challenging.
We went to every health board across Scotland to find out just how long people are waiting for an NHS ADHD assessment. You can find the full list on the STV News website, but for now we wanted to highlight some of the longest waiting times. In Greater Glasgow and Clyde, there are 3,985 children on the waiting list, and on average it'll take 65 weeks for them to get an appointment. There are 3,881 adults in Glasgow in the same position, and their maximum wait is 202 weeks. In Aberdeen City, it's 137 weeks for adults and 200 weeks for children in Lanarkshire. Meanwhile, in the Western Isles, children are only waiting for 16 days, but adults are in the lurch for 2 years. But the reasons behind why there are such long ADHD waiting lists in Scotland are complicated. There's not a standalone service that assesses people with the disorder. People are mostly referred to mental health services, which sees people with a range of conditions, not just ADHD. Meanwhile, several of the health boards told us that there's a significant shortage of resources and psychiatrists.
Dr Pavan Shireddy is a consultant in adult psychiatry for the NHS in Glasgow. He's also the Vice Chair of the Royal College of Psychiatrists in Scotland.
Have you ever seen a condition explode in the way that ADHD has?
No, I think honestly no. So I've worked in psychiatry for 20 years. Even when you look through literature and you talk to colleagues, it's unprecedented and in such a short space of time.
Pavan believes there needs to be one neurodevelopmental service that cares for people with ADHD.
ADHD is not a mental illness. It's a developmental disorder. You learn to live with it. You have treatments that can reduce the impact of the symptoms on your life. That's a very different approach to what specialist services, secondary care services are designed for. So there's a need for specialist neurodevelopmental disorder services.
Right now, there's a UK-wide shortage of ADHD medication, and the NHS is feeling the strain.
Supply chains just haven't been able to keep up with increase in prescription rates of 500, 600%. That's unprecedented. There's been a lot of work in trying to identify alternatives, but none of these options are going to address the shortages soon.
Social media has played a huge role in why there's been a spike in demand for ADHD services.
It does seem, when you type it into TikTok, there's thousands and thousands of hits. And people do seem to be almost self-diagnosing. Do you think this is problematic?
Greater awareness is always good. It encourages people to seek help, and that is positive. But what we also know is that there's a huge amount of misinformation or incorrect information. There's a recent study that showed that over half of the information on TikTok about ADHD was inaccurate.
A spokesperson for TikTok told us they're proud that the site is a place where people can share their personal experiences of neurodiversity, and said they take action against medical misinformation in line with community guidelines. For many of those who do have ADHD, the increase in awareness is a double-edged sword.
I think what's unfair is you're not seeing a true reflection of ADHD. You're seeing snippets of symptoms, which I think everybody does experience. I think I seen a video the other day and it's like, I walked into the room, forgot what I was going there for. I'm ADHD. It's more than that, you know, it's bigger than that.
Sean grew up feeling like he didn't fit in. As a child, he wasn't able to focus and fidgeted a lot.
I would sit with the books in front of me, but I would never know where to start or what I needed help on, and yeah, it was quite a struggle, and I ended up just leaving school halfway through 5th year because I couldn't really, it just felt like pointless me being there.
For a long time, Sean was told by doctors the issues he was facing were likely due to poor mental health, but nothing seemed to explain why he was constantly restless, had physical tics and struggled at work.
I phoned for a doctor's appointment and spoke to the doctor about ADHD and it was, her response was basically, well, do you want a label? What do you want from it? And I didn't really know what to expect. It was the last thing I would have expected somebody to say to me, so I was just like, nothing, like, that's it.
After not getting anywhere with the NHS, Sean decided to go private.
It was like an hour and a half's appointment, and halfway through she just stopped and said, it's obvious, like, you know, you're quite clearly struggling with it.
Sean, who has 3 children, is now in a position where he wants ADHD medication, but he can't afford it. Even though he has a private ADHD diagnosis, he can't access NHS treatment. And if he wants it, he has to go back to the bottom of the waiting list.
I've got no other option. They've made it clear the NHS won't see me and the GP won't accept shared care, but it's almost like you need to fight for it. And to be honest, I don't think I really want to go down the route of being assessed by another doctor again. It's quite grueling and it's quite time consuming, and you're bringing up things from childhood, your past, and it's just kind of like
it's emotionally
reliving.
draining.
Yeah. You're kind of just reliving your struggles over and over and over again.
I think it's fundamentally wrong that people are having to pay for a service that they deserve and that they should get within the NHS. And that's to do with lack of shared care agreements with GPs, a lack of ongoing monitoring. And that, again, is hugely frustrating because people spend thousands of pounds getting a diagnosis.
We reached out to the Scottish Government to find out how they plan to help people like Sean and clear up the ADHD waiting list backlog. The Mental Wellbeing Minister, Marie Todd, acknowledged that there is a problem and said we're working with NHS boards and community partners to improve access to diagnosis by upskilling health professionals on ADHD and supporting local health partners to develop existing local services.
I think it's difficult to know why there isn't the focus on this condition. The Scottish Government commissioned Queen Margaret University and the National Autism Implementation Team to develop a model for what they felt might be beneficial for people with ADHD. That report was submitted almost 4.5 years ago, and there's been no further progress on that. There's been a lack of political will, and I think that's immensely frustrating, not just for people with ADHD, but for professionals who want to provide that good quality care.
As governments and the medical industry work to create change, those within the ADHD community are doing what they can to get by. For Sean, even though he can't access treatment, getting a diagnosis has transformed his life.
I must say my mental health has improved since the diagnosis, and I'm able to take a bit of pressure off myself. Because there are a lot of positive things about ADHD, you know, very empathetic people, and we're great for a bit of advice, albeit we can't follow it ourselves, but we are good for advice.
Sean has always been incredibly close with his family, but now feels he can be a better role model for his children.
He's like, what is ADHD? And I'll always kind of focus on the positive things about it rather than the struggles, you know, so I almost like a superpower when I'm talking to him about it. He'll ask me lots of questions, and one day we were just kind of sitting, he said, what's it like? So I just round off everything that was going through my head a lot. He's like, that's noisy. That sounds really noisy.